Welcome to our virtual town hall meeting. I'm so excited about this discussion tonight. We're going to be talking about canceling HIV together in Prince George's County. And I've got a wonderful panel of folk who's going to come in and help us, some experts in the county, to answer your questions and to give you the information you need to know here in Prince George's County. Our first guest is Diane J Young. She's a registered nurse and associate director of the Family Health Services Division with the Prince George's County Health Department. Since joining the health department in 2012, Ms. Young has been responsible for several public health programs, including those associated with improving maternal and child health outcomes, ending the HIV epidemic, and for COVID-19 testing and vaccinations in Prince George's County, Maryland. Diane, welcome.
Thank you, Cheryl.
It's so good to see you. We've talked on the phone and did a phone interview, but it's really great to see your face tonight.
Thank you. Same to you.
All right. Our next guest is Dr. Tiffany Talafero. She is the HIV Specialist Patient Care Pharmacist for the Mid-Atlantic region of Albertson. She is also credentialed by the American Academy of HIV Medicine as an HIV pharmacist. Dr. Talafero opted to be on the front lines fighting the COVID pandemic and was the lead pharmacist operating COVID-19 vaccination clinic, consciously choosing to make a difference in her community. Dr. Tiffany, welcome.
Thank you. I'm happy to be here today.
I'm happy to have you and good to meet you. Also, our next guest is Toya Tolson. She is an African-American woman living with HIV who was diagnosed in 2004. She is part of the Sisters of the Heart Club at Heart to Hand Incorporated, where she has empowered women to stand up, overcome stigma, and live fulfilled and empowered lives. Toya has HIV, but HIV does not have her. I know that's right. Hi, Toya.
Hello, everyone. How are everyone?
We're good. Welcome, welcome to the town hall meeting. And then finally, we have, last but not least, of course, Clover Barnes is a nurse executive with over 20 years of combined experience in healthcare and public health. For the past 7 years, Ms. Barnes served as the bureau chief of the Care and Treatment Division of HAHSTA, I guess it is, HIV, AIDS, hepatitis, STD, and TB administration, where she provided excellent leadership and administrative oversight of the Ryan White program and DC Health ending the HIV epidemic initiatives. Clover Barnes, welcome.
Thank you so much. So happy to be here.
Listen, I think this is going to be such a great conversation. To those who are watching on our Facebook pages, our YouTube pages, and our websites, listen, if you have a question, if you have a comment, you know how we do these town hall meetings. We want to hear from you. We want to make sure that we're addressing the issues that you want to hear about. And on top of that, we've got some great information to share with you. So share it on your page, share it to all of your friends, tell everybody the town hall meeting has started, and this is where you get informed. So we're going to jump right in. So we'll ask this for you, Diane. What is the Cancel HIV campaign, and why has Prince George's County made it a priority?
Well, Cheryl, the Prince George's County Cancel HIV campaign really is centering around raising awareness related to HIV testing, treatment care, and prevention. We also talk about stigma, gender issues, and relationships. As part of a bold national initiative, we were funded to work on reducing our HIV rates. So the goal is by 2030 to reduce new HIV infections by 90%.
I love that. So as you can see, the banner is Canceling HIV Together in Prince George's County. And I think it's a collective effort, as Diane is saying. So tell us how HIV has disproportionately impacted some populations and community in the county. The last we talked, I know that when you talk about health disparities, it always affects our community at alarming rates, right? So talk about how HIV has disproportionately impacted some populations.
Unfortunately, Cheryl, for Prince George's County, we have been #1 in new HIV infections in the state of Maryland for the past 3 or 4 years.
Wow.
And 77% of those cases are in the African American community, which is alarming. And mostly in our younger population, with over 30% in those ages 20 to 29. And when we dig deeper into the numbers, 69% of the cases are in men that have sex with other men, and these are the new infections. And 43% is still in the heterosexual community. So it is not just one community that is impacted. It's really our entire African American community.
And that's so disheartening. Every time we have these health initiatives, we find out that we are disproportionately affected because we're not going to the doctor, and we're not being checked, we're not being on the front line, and we're not being proactive. And so I think that this conversation is one to get us started. As you could say, as it says, canceling HIV together in Prince George's County, and we have to do that together. So we have a video, and we're going to come right back. But don't forget, share, share, share. Tell everybody we're having this conversation. We'll be right back.
No matter if you have sex with him, her, or them, it is important to get tested for HIV. With essential HIV prevention methods like condoms and PrEP, a daily pill to protect you from getting HIV, you can be protected. Get tested for HIV, know your status, and stay protected so you can hang out with whomever you want. Together, we can cancel HIV.
That's the absolute truth. I love that. Again, together we can cancel HIV. So we're going to throw this question to Clover. An estimated 1 in 8 Prince George's County residents living with HIV are undiagnosed. So at the end of 2020, there were nearly 1,200 people with undiagnosed HIV in Prince George's County. So number one, what factors contribute to people not knowing their HIV status?
A lot of it is the fear of the unknown. You know, people fear what they don't know, and they fear if they test positive, it may be a death sentence. The other thing that we find is that stigma is a very motivating factor. People are afraid that people they know will find out, that their family will find out, and they will have negative perceptions of them as they try to progress through testing. They're worried that somebody might think they're gay. You know, our communities are small and interconnected, and you may know the person who's doing the testing or who's interacting with you. You know, somebody may think you do drugs or have sex for money, and those things can definitely stigmatize and prevent people from knowing their status. The other thing is not knowing how or where you can access testing. So it's important that as we cancel HIV together in Prince George's County, that we know where we can get tested.
I know that's right. So there are a number of places in Prince George's County. Are there clinics or any specific pharmacies, or just is it a website that folk can go to find out where they can get tested?
There are. Scrolling across the bottom, there's a number and a website where you can outreach to find your closest location. But Prince George's County funds community-based organizations, as well as has testing programs at the county offices that people can use as a resource to know their status.
That's great. So also, what has the county done to make it easier for people to know their HIV status? As you said, there are a number of places to go get tested, but what initiatives has the county done to make it easier for folks?
So Cheryl, part of what we've done is we provide outreach in the community. And we fund organizations that reach out to hard to reach communities. To educate them. They offer workshops, they offer health fairs. We do a number of social media campaigns, forums such as this one as well.
And this is how we get the information out. So if you're watching on any one of our platforms, again, share it and tell everybody we're having the conversation. So for Dr. Talafero and for Clover, HIV from start to now, what are we dealing with? What are we talking about? I know when it first came out, it was a panic. Everybody was making a panic. And as Diane talked about earlier, they made it a homosexual disease, right? They made it, they stigmatized it. And so then it was the drug transmission disease or whatever. Give us an updated picture of where we are, how it's, from HIV from the start to now, and how we're dealing with it.
Yes, so you're absolutely right. When it was first identified in the early 80s, it was initially considered a gay immunodeficiency virus. But since then, most of our achievements have been achieved surrounding the treatment. The first treatment option came in the late 80s, and then the standard of treatment came around the late 90s. But we have come a long way as research has progressed. We have things such as pre-exposure prophylaxis, which is a once daily medication used to prevent HIV. We have PEP, or post-exposure prophylaxis, which is a medication used to prevent HIV exposure. If you have possible exposure, we have diagnostic tests that are 99% effective that you can retrieve from your local pharmacy, from the health department. And what's extremely important to remember is we are not where we first started, but we do need more initiatives, and we really need to spread that awareness to make sure those people who are most affected by HIV are getting the help and the assistance that they need.
Clover?
And I was going to say, and in addition to that, we are engaging with high-risk communities to try to make an impact before they actually get HIV, as well as to work with different partners to fix the systems that don't work. There are lots of barriers that we find that people come into the community with. Like right now, people are disproportionately affected by COVID, which may be impeding them from getting into seeking care or seeking the help that they need. And we want to make sure that primarily the people who are at risk and have barriers, that we're addressing their social determinants of need and really looking at all those things that may keep them or prevent them from knowing their status and accessing the care that they so desperately need.
I love it. So I know that people are living with HIV. Before, when you were diagnosed with HIV, everybody thought it was a death sentence, and we were losing a lot of people in the beginning at an alarming rate. But what I really want to drive home, based on what you guys just shared, is that you don't have to die with it. Like, there are methods in prevention, and there's some things that you can do that even if you're diagnosed with it, that you can live with it. And I think that's a really great point to drive home, as you just shared. All right, so we're going to go to another video, and then we'll come right back with some more questions. But of course, if you have questions or comments, make sure that you're leaving them right there on our Facebook page, our YouTube page, so that we can communicate. All right, let's check out this video.
Stigma is all too familiar to transgender people, like being constantly misgendered. And sometimes we got to do what we got to do. Stigma makes it hard for our community to get the health care we need. We are still worthy. Things aren't always easy, but putting your health first should be. Prince George's County has safe spaces to help you get tested for HIV. If you are positive, all the services are right here, from medication to housing assistance. Know your status, take charge, and get it done.
Absolutely. All right, so we're going to jump right into our questions again, and this time, this question is for Dr. Tiffany Talafero and for Toya. What are the HIV treatment options for someone who is diagnosed with HIV? As we jumped the gun a little bit before, but there are some options. There are some things that people can do.
Yes, so the treatment options for people with HIV are called antiretroviral treatments, or therapies called ART. That is the primary treatment. And there's currently more than 30 FDA-approved medications on the market to treat HIV. Your HIV treatment will depend on your individual needs, your side effects, as well as drug interactions. But it's important to remember that being diagnosed with HIV is not a death sentence anymore. And you're no longer taking 30 to 40 pills like they were back in the early 90s. They have a lot of one pill combinations. And the most important thing to remember is U equals U, which basically means that if you're taking your medication once daily as prescribed, you can become undetectable. And if you become undetectable, you can become untransmittable, which means you cannot pass the virus on to your sexual partners.
That is amazing. So I didn't know that. I know that because people will tell you to still just remain safe. And, even if you have it for life. And so, but I didn't know that now they have drugs so that you won't have to be able to transmit it. That's pretty dope. I know we lost Toya, so we're going to continue.
Back.
Oh, she's back. There she is. Hey. There she is. All right. So Toya, what are the HIV treatment options for someone who is diagnosed with HIV? I know you're living with HIV and you're an advocate for it. So talk about some of the treatment options that you've had.
am on 2 regimens. But they have a 1 pill a day or injections. But I choose to stay of what I've been on for the last, as you stated, since 2004. But I'm good, satisfied, because the 1 pill, the side effects wasn't on my block.
Mm,
And I thank God that I recognize going on with my body
mm-hmm,
and let them know, my ID doctor, that no, I can't do this. I mean,
mm-hmm,
it's always good to know what's best for you, I believe.
mm-hmm. And it's
A
awesome
guinea pig,
too.
I will not be.
Oh, that Deidre said, we're so proud of you, Toya. But it's awesome. I mean, it's awesome, you know, you do know your body and that there are options, right? So there's not just one thing that you can do, but there are a number of things that you can do, and that there are options for you to contain to stabilize your illness. Now, what support do people living with HIV need to stay engaged in care? You know, I know that Toya is an advocate and has different groups that she's been talking with, but Dr. Tiffany, grab that question for us. What support do people living with HIV need to stay engaged in care?
Yes, it's important that everyone who has HIV has an HIV treatment team. This can consist of medical providers, your local pharmacists, case managers, mental health providers, but also having those support services, housing support, food support, mental health support is important. And then getting engaged in like social media, being involved in HIV awareness to let people know that this is something that involves everyone in the community.
Mm-hmm. Toya, what support do people living with HIV need to stay engaged?
Are you speaking to me?
Yes, ma'am. What support? What
I
support do
apologize.
people?
Repeat, please.
Yeah, what support do people living with HIV need to stay engaged? I know that you are a part of a number of organizations to encourage those who have HIV. So talk about that. What support do people living with HIV need to stay engaged in care? Uh-oh.
Striving to live and understanding your truth.
Mm-hmm.
Don't let it have you. You know, live for yourself.
Mm-hmm.
Negativeness is truly, we beat ourselves up more. I know I did in the beginning, but all in all, I love me. So I
Mm-hmm.
want to do better and encourage those to continue to.
Right. And so I think that with a community of support with family members, even if family members don't understand, I think that there are people who do understand, people like the organizations that you all are a part of, that you can create a community of people to help you, you know, to stay engaged with your care and to know, like you said, Toya, you had to get to a place, right, of understanding, you know, I love me and I want to live. And I want to survive this, and this doesn't have to have me. So what was it that got you to that point?
Learning me. Don't let someone dictate me. Confusion is a mental game,
Mm-hmm.
and it'll put you in a hole that I don't want to do. Or I'm tired of this, or I'm tired of this. Let me do me. I didn't go back, and I just fought to go forward.
Awesome. 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 So, Dr. Tiffany, what are the conditions, environments, or environments we create so people can be healthy and receive the care they need? And I love this question because now our audience and those that are watching can take some of these examples, right?
Yes. So, as a registered pharmacist, we want to make sure that people have access to what they need, whether that be testing, treatment, pre exposure prophylaxis, or PrEP to prevent HIV, but also making sure that we're specially trained healthcare workers, making sure that we're providing culturally competent care, safe, non judgmental environments, like Toya mentioned, and then really advocating for those who have HIV, whether that be health insurance assistance, copay assistance, education as far as diet, housing, food, educating on how to stay safe, on medication adherence, as well as how to protect your loved ones is extremely important.
Toya, you want to jump on that one too? What are the conditions or environments we create so people can be healthy? And what were some of the environments that you created to remain healthy and to receive care?
Positive atmosphere. The negativeness or just knowing this is not me. I know what I can do and what I should be doing for me. And just keep your head up. Again, don't let it control you. Control it.
I love that. I really love that. And I love your passion about it. I saw a comment from Ron Thompson, our program director. I want to share that. So he pulled up a few statistics. He says, researchers just announced fourth person possibly cured of HIV. Can you speak about the research? Will it be available for everyone? Dr. Tiffany, you want to jump on that?
Yes, I can definitely touch on that. So I think we've definitely come a long way from the past 2 decades. When we first people were diagnosed with HIV and AIDS, it was universally a fatal, untreatable illness. Now we have it and it's pretty manageable chronic condition. What's important is that the treatment is making it easier and better. But as for a cure, I think we have a while to go before we have that official cure. I do believe that once we have the cure, it will be a scientific breakthrough. I know looking into the studies they have so far, people were healed with bone marrow and like stem cell research. And I guess as time progresses, that will be coming more into the light. But right now, I think we need to just focus on the treatment options we have and that scientists can continue working on the cure, because all of those were like very limited conditions. But hopefully in the next coming years, we will see more studies with using that type of technology to cure HIV.
That's awesome. Diane, you want to jump on that one as well?
Sure, Cheryl, I think it's really important to manage the message around cure because people hear that as a soundbite and think that it really is an active cure available to everyone. Folks need to understand it takes a lot of research to go into that. And what does cure really mean? When we started with PrEP and ART and people became undetectable, when you tested them, folks associated that also with a cure. So we just want to be careful. Our words matter and we don't want to confuse the public. It's not something that's widely available, but as Dr. Tiffany said, this is something that we look forward to in the future.
I like it. And you're right, because I've known people who've become undetectable, right? And so when you think that and when you say that, you feel like that's a cure. But I'm glad that you made that distinction for us tonight. Clover, did you want to jump in on that as well?
I would just like to add that research is ongoing in the county and in our region to try to understand and learn how these drugs and these different techniques affect different communities and populations. But as Diane, she hit the nail right on the head. It is not anything that's widely available or that's going to be something that we're going to be rolling out to the community at large anytime soon. It takes a long time and a lot of research and approvals to really get to the point where these things will be available widespread.
Wonderful. Shima says, been living with this since 2016. And so he's glad that we're having this conversation. And so am I. So am I. I'm going to go ahead and jump to another video, and then we're going to come back and continue to answer questions and give some more information. So let's check out this video.
I'm Linda H. Scruggs. I'm a resident here in District Heights, Maryland, in Prince George's County. I've been diagnosed with HIV for over 30 years. Knowing your HIV status is very important. If you're thinking about getting tested, don't be fearful of the test. Getting tested is power, because power gives you knowledge. Please get tested for HIV. If you're newly diagnosed with HIV, please connect with a healthcare provider so you can understand your treatment options.
Wonderful. I've seen her on commercial So it's pretty dope to see her here with us tonight. So we're back with our panel of experts. Canceling HIV Together in Prince George's County is what we're planning to do. And of course, because we're worldwide and we're on the World Wide Web right now through Facebook and YouTube, I love that this conversation will go across the world and people can also glean from the information that we're sharing tonight. So this question is for anyone who wants to answer it. What messages or information would be helpful for people in the community to hear about HIV as they also struggle with issues of COVID? Because COVID seems to be like the big health issue right now, and it really is a big health issue. But because we're talking about HIV, what information would be helpful for people in the community to hear about HIV as we struggle with the virus?
Cheryl, one thing I want to add is we need to have conversations and have it a normalized conversation. This is a normal part of everyday living, just like people that have high blood pressure. We need to remove the stigma associated with being diagnosed with HIV and all the judgment that goes along with it so that people can live their lives and to be healthy. The health department has lots of support services to support anyone who wants to be tested, who wants to go on PrEP, who needs PEP, who is really looking for a case manager. So we do a lot of outreach into the community.
Anybody else want to add on that?
I'll just add that the county has all the resources you need, right? So right now with COVID, like everybody's real bent on knowing their status and making sure they're tested. Well, you can get your HIV test in the county as well when you get your COVID test. And so it's important that, as we're looking at the things that are affecting folks in COVID, those social determinants of health or barriers that may impact them going out and getting to do the things that they like and want to do, we want to make sure everybody gets tested for both HIV and COVID when you're engaged in the healthcare system and make sure you know your status.
That's good. Dr. Tiffany?
I think everybody hit the nail on the head with that, but just knowing that you can, we have options for people with HIV as well as COVID, and your pharmacy, your providers, they are there to help you and assist you with both.
In these times, my boss and I, Ron, we laughed and joked at each other because when it came time for the booster, when it came time for us to get tested, we said we're taking everything. We're doing the flu shot. We're doing the booster. We're doing. We were laughing at each other, but we were serious about that. Shingle shots. Look, we're taking it all, right? We just want to make sure that we're protected. So I hear that when we're talking about HIV, right? So we're so concerned about COVID. We need to also make sure that while we're there, go ahead and get tested. Go ahead and get tested. Do it all at the same time. Make sure that you're not a part of the statistics of our community saying that you didn't know about it. You didn't get tested. You let it go. The stigma, as Toya talked about, kept you from going and getting tested with all of the resources that we have here in Prince George's County, as Diane has talked about. I want you guys to make sure that you're taking advantage of that. All right, we have a comment from our community. Sharing your experience in group and with others who create a safe space can be a large part of managing HIV. We want everyone to know that there are many options available in the community. Thank you, Anne. And so that's one of the things I know that Toya is a part of. A group she's a part of, Sisters of the Heart. And Toya, how has that experience been with you dealing with when talking with other people and connecting with that community? How has that been for your success with living with HIV?
It truly was a growth experience of me being stigma locked.
Mm-hmm.
I was shelled. I wouldn't spoke, but I just went, participated, sat in, and then I got really comfortable, and started engaging with one another to break them out of that stigma. I've been with Heart to Hand since 2008.
Okay.
So it was a blessing of one giving me the number and everything because they knew that I needed to be around those that could relate to what I was dealing with. I need to be around them rather. And it's truly a beautiful experience. And
Awesome.
for me to still be with them.
Right. And I love how when when you're able to help yourself, when you're able to, find answers that you're able to pour back into the community. I think that
Yeah.
whole snowball effect of positivity is something that we need. So Diane, these questions are for you. How or where do people in the county get information on HIV and HIV services? And then what are some trusted sources of information for people living with HIV?
Sure. Cheryl, they can get information directly from the health department. They can call our office at 301-583-3150. That number is scrolling at the bottom of the show. They can also go to our website to get information as well as to the Maryland Department of Health and to the CDC. We have a number of community providers that we work in partnership and we fund, like Heart to Hand and Us Helping Us, that provide direct services and information to the community, and they are trusted partners.
I love that. And when you're talking about trusted partners, are there people preying on people with HIV? Like, are there scammers out there?
They're scammers everywhere. They are. At one time, we had a group of people that were charging residents to fill out applications
Wow.
to join the Ryan White program. And we know that there is no charge to join Ryan White program, and you don't do it through an application with some person that's saying, "Pay me $25 and I promise to get services to you."
Well, I want us to understand that if you're paying for it, if you're paying to find out this information, if you're paying to get the resources that they're talking about that are free and offered through our health department, you know that that's a scam. That is that's a scam. All right, we have another question. Um, all right, so Elena is asking. She says, "I've heard about U equal U. Can you explain what this means to HIV treatment?" Dr. Tiffany, you want to jump on that?
Yes. So U equal U is just a way of saying undetectable equals untransmittable. So what that basically means is you're taking your medication once daily as prescribed, or however it's prescribed to you. Some medications can be twice a day. You can become undetectable, which means that the virus in your body is not able to be seen on an HIV test. It means your CD4 count or your cells have done what they supposed to do, and your immune system is working properly, which means now that even though you have been diagnosed with HIV, you're unable to transmit it to your partner. That doesn't necessarily mean that you can have unprotected sex. It just means that if you're getting an HIV test, it'll be undetectable, which means you won't transmit it to your partner.
Got it. Diane, do you want to jump on that one as well?
Oh, Dr. Tiffany is right. The one thing I wanted to add, as she was bringing up, it doesn't protect you from everything. So condoms are tried and true, and they do protect you from other STIs. ART does not protect you from getting chlamydia, gonorrhea, syphilis, or any of the STIs. Neither does PrEP. And we want to make sure that people know that they have a full toolbox of things that they can use to prevent HIV and STI transmission.
Awesome. Clover?
I think Diane and Dr. Tiffany have wrapped it up. But I will say that it sounds kind of gimmicky, right? U equals U, like what does that mean? But it's been proven. We talked about research and how it takes some time to understand and really be able to document the things that are happening and really have it proven over and over again. And U equals U has been proven. Like it is documented, it is accepted around the world that if you can get your viral load to be undetectable, you won't transmit HIV to another person. So we really just want people to really work hard to get their viral loads under control, to stay engaged in their care and take their medications as prescribed. And that will help us definitely end cancel HIV in Prince George's County.
Awesome. Awesome. I'll take an undetectable diagnosis, right? If that's a success of living with HIV. So we have George Jones was asking the question, what is the Ryan White program? Diane?
Well, Ryan White is a federal program that funds people living with HIV. And under the ending the epidemic, it also helps to fund people that are HIV negative but are at high risk. The Ryan White program provides a full array of services for folks that are eligible, including medical services, support services like mental health, housing, emergency, financial assistance. So there's a lot that goes into it: housing assistance, child care, everything that could possibly be needed to help someone stay healthy.
Mm-hmm. Dr. Tiffany, you want to talk about the Ryan White program, or is it all explained through Diane?
I think Diane explained it pretty well.
Mm-hmm. That was pretty cut and clear. Yeah.
Well, Cheryl Clover actually is the expert on Ryan White.
That's right. I
She
that on her bio.
provided oversight to us as a grantee for many years.
Got it. I did see that on her bio. You want to touch on it, Clover?
I'll just give a little background on how Ryan White came to be, if that's okay. So Ryan White was a little boy who lived in Indiana who was a hemophiliac, and he was diagnosed with HIV through a blood transfusion. And his family really advocated for rights and for care and for support for people living with HIV. It was in the early 90s, so there wasn't a lot known about HIV in the way that it is now. And so it was very, very stigmatized as a kind of gay and white kind of thing. And it was not something that anybody wanted to live with. You know, there's stories about how the little boy, he was elementary school, middle school age when he was diagnosed. Like the people at school wouldn't sit near him. Like when he walked through school, like the sea would part. And so it was really hard on him. Think about a young teen child trying to navigate life in general, much less have HIV in a time when people don't know about it. And so it took a long time, but about 32 years ago, they passed the Ryan White CARE Act, and that stands for Comprehensive AIDS Resources Emergency Act, and that provides funding to states and to territories with a really high burden of HIV to make sure that there's kind of a safety net system for folks to be able to get care, the care and treatment they needed. And Diane was right, it funds medical services, support services, kind of the things that wrap around you and make sure that you don't have barriers to getting your care, whether it's child care or food assistance or transportation. Sometimes language is a barrier. So there are provisions in Ryan White that will afford all those things. And Prince George's County has been an amazing Ryan White grantee for many years, and they provide great services both through the state and through the Part A Ryan White programs.
I love it. I love it. I remember the Ryan White story as it was hitting a number of the talk show circuits during that time. Mm-hmm. And remember my heart going out to him because of the stigma and for people not understanding, having loved ones who have died with HIV, loved ones who are living with HIV. You become sympathetic and you start educating yourself as to how, you can be a support. And so that's what I'm admonishing to those who are watching today. All right, Elaine says, at what age do we need to start talking about HIV to our young people? I think that's dope. I think that's a great question. So we'll let all of the panelists ask that. So we'll start with Diane.
So I'm one of those sick nurses that talk to their 7-year-old about a lot of different things. My children were very interested in anatomy and physiology. So I started talking to them at a very young age. And I really encourage parents, if their child is mature enough at around 10 or 11, they need to start having those conversations. We've had children as young as 12 that are diagnosed with HIV. So we really do need to have that preteen conversation. Children don't think about growing up, really. They don't look forward to the future. They live for now, and they really don't understand the consequences of the now. When they're having sex and really don't even understand what sex is or the consequences that go along with it.
Got it. So, Dr. Tiffany?
Yes, that's a great question. I think there's this misconception in our community and all communities that if you don't tell me you're HIV positive, I'm just going to automatically assume that you're negative. And we need to sort of switch that mindset to think, if I don't know your status, I need to assume that you're positive. So there's no perfect age to start talking to your teen, but you have to understand that teenagers are having sex younger and younger. So it's better to start talking to them earlier than to have this conversation later. You'll be surprised about the amount of college students who go off to college and don't even know that they're the people who are most impacted by HIV. So if we can just get ahead of that and start providing that type of education to middle school students, to elementary school students, and just little atmospheres, it will definitely make an impact.
That's good. Clover?
I also think that we've gone through life a bit talking about, through the perspective that if we don't talk about it, they won't be curious. If we talk about it, we're going to promote them doing something. But I think we're at the point now with the internet and all of the access that children have to information and data now that we need to be talking sooner rather than later. I really like the 10, 11 age because you find that children that age are curious and they're looking at things and they have access to things. I'm a parent of a 10-year-old and a 13-year-old, and we have lots of talks about lots of things. So that they know from me rather than learning from their friends who don't know any more than they know at this point in life. And, sometimes that advice is what leads them to things that we don't want them to get into. Right. And so I would encourage folks to have honest and open conversations and dialogues with their children or with another trusted adult. It's okay to have a network of trusted adults who can advise and inform young people on which way to go and how to navigate through this crazy maze we call life.
Absolutely. My granddaughter is 7. And I believe at her age, we should start having conversation because they're social media savvy. They're on, TikToks, and they are, they're playing Roblox, and they're with their community of friends. They're, engaging with people outside of the home, especially now during this pandemic. They're living on their social media platforms. And I think that, even at 7, I hear Diane in elementary as a youth pastor. I know that this is conversations that we need to have with our children, even in elementary school. And I think it's a way to have it at their age. Like, it's a way to discuss it, that's child friendly. But I think that it is a conversation that we need to have. Toya, what would your comment be based on that? How early do you think it is that we should be telling our children or talking to our children about HIV and AIDS? Toya?
I am with Miss Diane. I mean, with all of you all, because I don't have any kids, but I have nieces and nephews and greats.
Right.
And they just moving too fast, grown. And then they exposed with that Facebook and all of that electronics behind the pandemic and the schooling. You never know what they on. My nieces and nephews tell me I'm mean, and I tell them that name you put in front of mine, go to your mom and dad.
I love Toya.
I mean, what I've been through. I lost a child when I was 16. 3 hours. I gave birth. He died 3 hours after birth. So if I did it to myself then and beat myself on that, to go through that pregnancy and to hold my child, hear his cry. I mean, yeah, we got to do something with them. Yeah. And these kids over here where I live at, believe me, Bellhaven, Summer Ridge Apartments, 202, or Martin Luther King, or whoever the who. These kids, there go Miss Toya, there go Miss Toya. Yeah, I is, and I hear you too. That's just me, and I'm just 4'11", and I ain't scared.
I love it. I love it. But yeah, I hear and I believe she's right. Like, our kids are are electronic savvy, right? They're electronic savvy. Before they can even talk, they could scroll. They could find icons and they're finding stuff on YouTube. My grandson's not even in school yet, and he can definitely find YouTube. He can find what he's looking for on the phone. And so they're stumbling on things, you know what I mean? And they may hear stuff, and my ears are open when I hear my granddaughter communicating with her friends and they're talking or whatever. I want to know what you scrolling. I want to know what y'all peeking at. And so if they can do that at that age, I'm like Diane, I think the conversation can start as early as elementary school. All right. So what more does the county need to do with the current service, media campaigns, et cetera, to end HIV epidemic? And so we'll start with Diane on that question. I love that you used this platform through Urban One to get the word out to our community. I really appreciate that. And I thank God for the audience, their participation, and sharing it out like that. But what other campaigns is Prince George's County doing?
So, Cheryl, one of the things that we need to do is to consistently engage our residents like Toya, and people that are HIV negative and at high risk to fill knowledge gaps around HIV testing, prevention, and care. We have an advisory board that is comprised of folks that are community advocates, educators, experts in the field, folks that have lived experiences around HIV, and those that care about what happens to our community. And we seek advice from them on what we need to do. One thing that ending the epidemic, a plan for America did was allow us to develop a plan for our residents based on what the residents want, instead of us telling them, here's a prescription for what you need to do. They told us what they needed.
Got it. Anybody else want to grab that?
I'll just jump in and say that community engagement is key. You know, the only way that we can really cancel HIV in Prince George's County is to really get at the root of what the people want and need and understand behaviors and patterns and things that keep them from seeking care or understanding their status or knowing, fully engaging in the healthcare ecosystem. And so that community engagement that was funded through the End an Epidemic plan for America, as well as the services that are the result of it, are really ways to really wrap around the community, engage them in ways that they have meaningfully asked for. And I think that's so important in order to reach the residents of the county.
Got it. Got it. Dr. Tiffany?
I think everybody touched on what's important, but making sure that you have someone to speak to. There are your healthcare providers, there are pharmacists. We are here to support you. Let them know what you need and let us provide those services to you all.
Mm-hmm, mm-hmm. We do have a few more minutes left. I love this, Deborah. She says, I believe that people should move away from stigma. We can stop the spread of HIV. People are so afraid to speak out. We can't get nothing done if we continue to allow stigma to stop us from being who we are. What do you think on that? And so we touched a little bit on that, but I definitely do want to talk about the stigma and the importance of erasing the stigma. I was going to go to Toya. She's just scrubbing a little bit. So let's go ahead with you, Diane. You're always our go-to because you're such a great, informative person. So let's start with Diane. Let's talk about how we can erase. We got a few more minutes to go. So I want to engage some of the questions coming from our audience. How can we start erasing the stigma of HIV?
It goes back to what I said earlier, Cheryl, about normalizing the conversation and making HIV part of routine care. So the CDC recommends that anyone between the ages of 13 and 64 get tested for HIV as part of a routine test at least once in their life. And then annually, if you're at risk and if you're having sex with anyone, you're at risk, even if you're heterosexual. I always tell people it's just part of your regular PCP visit. My PCP does not tell me that they're testing me for liver disease and cardiac disease. They just run a battery of tests, and one of those tests is HIV. They don't need my permission to do it. It's part of routine care, and people really need to understand that. I really look at people when they say they've never been tested and ask them, why not? Instead of flipping it on people who get tested, like, ooh, what's wrong with you? Why are you getting tested? Why aren't you getting tested?
So let me ask this, Dr. Tiffany can probably answer this, or any one of you. When we do go get our routine checkup without even asking for it, would they do it, or do we specifically have to ask to be tested for HIV? Clover is talking, I think, yeah.
Yeah, that's a good question. So they can do it without your permission, right? That is allowable. It's an allowable test, an allowable expense. But sometimes providers don't always remember either. And so I think it's important to have the conversation, right? To say, did you test me for HIV? Have I been tested? Can you give me the results? Have that conversation with your provider. We should be talking about all the things that we're experiencing in our bodies and with ourselves, with our providers. And HIV should definitely be one of them. There's no age, there's no sexual orientation, there's no gender that is going to make you less likely to get HIV. Anybody can get it. All of us are at risk if we're having sex or doing things that exchange body fluids that can let us get to that point. So we should be knowing, one, the status of the people that we're interacting with, right? When we're having these relations with, we should be asking them, do they know their status? Maybe we can go get tested together before we do other things later on today, and we'll know our status together. It's important to normalize that conversation. It shouldn't be a stigma. It shouldn't be a oh my God, I can't believe you asked me that, type of situation. It should be normal for us to talk about, just like somebody would say, oh, I can't have cake because I have diabetes. It's okay to say, oh, do you know if you have HIV or not before we go upstairs and lay down? Like, I think it's important to have those conversations and to normalize that. And if we do that, then we'll stop the spread of HIV, because people will know their status. And if they have it, they'll be able to go and seek and get treatment. And it's okay to talk to somebody, to your provider, to your pharmacist, to some member of your healthcare team, to reach out to get the care that you need, whoever you connect with. It may not, if it's not your doctor, it might be when you go see Dr. Tiffany at the pharmacy. You could talk to her, but you need to talk to somebody. You might see Diane when you're at the health center, and you could say, Miss Diane, I saw you on the town hall, and I just want to know my status. Can you help me? And Miss Diane can help you. You might see Toya when you go to Heart to Hand, and Miss Toya can say, let me take you over here and introduce you to this person who can help you get your testing. So, there's no wrong way to enter the system, but you need to reach out, and everybody needs to reach out to know their status and to engage meaningfully with the people who are there to help them. That's what we're all here for. If you see me in the grocery store, I will help you figure out how to get an HIV test. Like, it's okay. Like, we will figure it out. And it should be okay for you to reach out and talk to somebody about it without feeling like you're dirty or unclean or anything like that. I saw a comment pop up that say that HIV is no longer a death sentence.
Yes.
People are living and thriving with HIV. Look at Miss Toya.
I love that.
She's fussing at the kids outside the house.
Right. She about to beat up the babies now. Don't mess with Miss Toya.
Yes.
HIV is not stopping her from letting you know.
Don't do that. Don't do that. I'm just mean and hot, but caring.
No, I know that you are. But I love that you said, I'm 4'11", and they ain't gonna mess with me.
That's right. I mean, you better stop.
Right. So Chima says, when I first found out I had HIV, I was scared and crying, but thank God for the provider that helped me get undetectable. And so I know that when you're first diagnosed with it, there has to be a fear that grips your heart. But I love that we've talked about the medical treatments now and the things that you can do to become undetectable. Dr. Tiffany, I know we were talking about the youth earlier. And so one of the questions that popped up on YouTube was, asking how to talk to our children. How do we tell, talk to kids about that? But how do we talk to adults who, I've been married 25 years. So, and I've had that one partner for the whole time that I've been married. Thank God. Praise God. But even in that, I think that we still need to be tested. And I trust my husband and all of that, but I know that might come with some controversy because, if we've been only together with each other, then how in the world do we have HIV? But you can't make those assumptions, right? Talk a little bit about that, Dr. Tiffany.
Yes, so definitely we can't make those assumptions. Just like Diane spoke about earlier, just living in Maryland and DC alone, we have the highest risk of acquiring HIV among the other 50 states. So just living here and having sex is going to put you at risk for HIV. And like I said, it's a common misconception that if we're not talking about it, I'm going to automatically assume that you're negative. And that's what we need to fix. We need to go in and be like, hey, you're my partner. We've been together a while. let's get HIV tested together. Let's go in and do this together as a couple and make it a date out of it. Make it a fun experience where we're just trying to get to that place in our healthcare. And making sure that you are speaking to your providers. Some providers may not mention it to you, but it is important that you say something to them, and they can help guide you in that conversation of how to speak to your partner. We can definitely bring your partner in and speak with you. There are organizations who will reach out to your partner for you, even if you're afraid to do it, and just promote that service for you. So definitely just have, you know, your partner better than anybody else. So whatever type of services that you need, make sure you can have that conversation and get them to come in and just make a date out of it and get HIV tested together. Because the most important thing to know is your status.
Mm-hmm. And if you've had blood transfusions, I mean, there's other ways, you know, outside of being sexually transmitted that that you can get AIDS as well, or HIV as well. Let's talk about that. The difference between AIDS and HIV. There is a difference, right? Dr. Clover, I done gave you credentials. Clover?
There is. And so, you know, you don't hear us talk about AIDS a lot
Yeah.
in that same way. So
Yeah.
usually it has to do with the staging of when you got diagnosed. Basically,
Oh.
like how long you've had it, how much is in your body when we talk about HIV versus AIDS, and like the status of your immune system at that point. But the treatments are the same, right?
Got
So
it.
we still want you to get engaged, whether the time that you get diagnosed has you at one status or another. We don't necessarily classify it in that way now, you know, where, you know, this person came in with AIDS and this person came in with HIV. But we do want to understand kind of the patterns, right? So as we're planning and using data to make decisions about the programming and the types of services that are needed, you know, those things are important on the background. But the services that you need and the medications that you require and the type of care that you'll get will be the same. You're going to get the same. It's just a point of, you know, what status is your immune system in at that point.
Got it. Brenda said, having HIV is not a death sentence. Getting immediate treatment promotes life. I love that, Brenda. And thank you so much for bringing that banner back up. We've got about 3 minutes to go, and I want to make sure that we're getting everything in that we want to get in from Prince George's County Health Department. Today's show is called Canceling HIV Together in Prince George's County. Diane, we'll start with you with some final thoughts and final comments to our audience.
Sure, Cheryl. I just want to encourage everyone to get tested. If you've never been tested, regardless if you're in a monogamous relationship, a relationship that you believe is monogamous, you should be tested for HIV. You should always know your status. And if you end up positive, seek medical advice from a qualified provider. Everyone can come to the health department. We have a great physician, Dr. Tremaine Davis, who takes outstanding care of her patients, and patients just simply love her. So if you can get into care and treatment at an early age, in an early stage of your infection, you can live a long, happy, healthy life. Toya is a prime example of it, and I love that she is showing what HIV can look like in our older population, and it gives hope.
That's so good. Dr. Tiffany?
Yes. So it's important to remember that, like we've said a couple of times, HIV is not a death sentence. There are options. There are treatment options. There's preventive measures such as pre-exposure prophylaxis or PrEP to prevent you from getting HIV. It's just a conversational starter. Don't be afraid to speak with your healthcare worker, with anyone about HIV. There's pharmacies on every corner. Our Safeway pharmacies have Center of Excellence HIV stores, where we will specially trained pharmacists will help guide you and provide that assistance, whether it be connecting you to care to get you on pre-exposure prophylaxis, connecting you to get HIV tested. We have these services. So don't be afraid to just reach out and do that. Speak to us so we can help you with that research.
Awesome. Toya, you have any final thoughts to our audience? Any final point you'd like to drive home before we close out? Toya? I'm not sure if she can hear me. How about Clover? You have any final thoughts? or
I'll
comments?
just echo what Dr. Tiffany and Diane said. Go to the website or call the number scrolling at the bottom of the screen. Reach out and get the assistance that you need. Whether you're not sure if you know your status or not, or if you need help getting there, don't let those be barriers. Reach out and get the help that you need. They will help navigate you to how to get there and get the services that you need in order to protect your health and stay well as well as possible.
This has been an amazing conversation. Thank you guys so very much for joining us tonight for our town hall meeting, Canceling HIV Together in Prince George's County. Don't forget to call the number that's scrolling on the bottom, 301-583-3150 to get tested, or visit health.mypgc.us /ending HIV. All of the information is found right here. It's on all of our websites. It's on our social media page. Thank you to our audience for being so great, so engaging. Thank you for your questions, your comments. Thank you for those who are transparent. I really, really appreciate that. Appreciate your experiences tonight. Thank you to Toya. Thank you to Diane. Thank you to Clover, Dr. Tiffany. We appreciate you guys for all of this great information. Let's keep talking. Let's keep loving. Let's keep sharing. Let's keep giving information that is positive. Let's keep getting rid of these scammers, Lord, preying on these people. But we really appreciate all of this information. Thank you to the Prince George's County Health Department. And so that's going to do it for us tonight for our town hall meeting. Have a great